All right, you're responding out to one of the local care centers. This is going to be for a 65-year-old male, unconscious, unsure of breathing.
Okay. Arrive on scene, BSI, scene safety, number of patients.
Just one.
Okay. Any considerations for C-spine or trauma?
No trauma has been indicated at this time.
Okay. And the patient's in bed?
Patient is in bed right now, yes.
Okay. And do I have enough resources?
Currently right now you have a fire engine responding and yourself.
Okay. I approach the patient. Does he respond to my voice?
Patient does not respond to your voice.
Any response to painful stimulus?
No response to painful stimulus.
Okay. Check for carotid. Any pulse?
You have a very weak carotid.
Okay. At this time, I'd like to get a history from the staff. I'm sure they're busy getting that for me, and I'd have my partner get a set of vitals. I want blood pressure, pulse rate quality, skin signs, SpO2, blood glucose, end tidal, and pupils.
Okay, so your vital signs at this time are going to be a heart rate of 172, blood pressure of 56/32, respirations of 6 at this time, SpO2 of 72%, ETCO2 at this time is going to be 24. As you start, blood glucose is going to be 72. And you start your ECG at this time, showing this on the monitor. History, the patient has a history of renal failure.
Okay,
And
so at this time I'm going to treat what I need to treat, and I'm going to also label that this patient is unstable. I'd like to have my partner insert an OPA if the patient accepts it. If not, an NPA, and then start ventilating at 15 with a BVM, 15 liters a minute, to bring that SpO2 up. Like I said, I feel the patient's unstable, and we'll see what the monitor says.
Okay.
Looks like I got VTAC on the monitor. Like I said, it's an unstable patient, so I'm going to put pads on the patient.
Okay.
And I'm going to back out of here and press my synchronize button because I want to synchronize cardiovert. I'm clear, you're clear, everyone's clear.
Shock the patient at this time, and you're now showing.
I got
this.
VFib on the monitor. I'd like to start CPR, 30 to 2. I've already got the BVM going. I'd like to start an IV. If I'm unsuccessful with an IV within 1 to 2 minutes, I would then start an IO. It is a witnessed arrest, so I would like to actually defibrillate now. Charged at 120. I'm clear, you're clear, we're clear. Let's get back on the chest. 2 minutes of CPR. Once I got my IV started, I'd like to give an antidysrhythmic. I'd like to give lidocaine 1 milligram. How many kilograms is my patient, or how many pounds?
Your patient is 100 kilograms.
Okay. Then my first dose is 100 milligrams of lidocaine. Give that IV there. How's my ventilations going? Am I getting good compliance?
You are getting good compliance at this time.
Okay, what's my end tidal?
Your end tidal at this time is 20.
Okay.
And your pupils are pearl.
Okay. Do I have any history back from the staff?
Yeah, you have a history of renal failure, a history of a past MI, and a history of hypothyroidism.
And when was this patient last seen acting normal for patient?
Patient was last seen acting normal about 30 minutes ago.
Okay, any complaints at that time?
Said he had a little bit of chest discomfort.
Okay, and does the patient have a DNR?
Patient does not have a DNR, full code.
Okay, and the age of the patient?
Age of the patient is 65.
Okay, and why is this patient at this facility?
Patient was unable to take care of their dialysis and renal failure, so they were sent to the facility.
And when was the last time this patient had dialysis?
Last time they had dialysis was 2 days ago.
All right, I'll continue on with my 2 minutes of CPR. Ventilating, bagging, CPRing. Has it been 2 minutes
It
yet?
has been 2 minutes.
Okay. Like do a rhythm check, pause CPR. Looks like I'm still in VFib.
Yep.
I'm gonna charge at 150. I'm clear, you're clear, everyone's clear.
Okay.
Defibrillation, back on the chest, CPR, continue ventilating. Now I'd like to give 1 milligram of epi, 1 to 10,000, 1 milligram. IV push with a 20 cc follow up with my bag that I've started.
Okay. At this time, it has been another 2 minutes.
Okay. Stop CPR. I'm gonna check my monitor. Looks like I've got sinus rhythm on the monitor. Do I have a pulse with this?
You do not have a pulse.
No pulse, that's PEA. I'm gonna continue with CPR and ventilating.
Okay.
I'd like to consider my H's and T's, hypovolemia, hypoxia, hydrogen ions, thrombosis, tension pneumothorax, toxins. Patient does have a history of dialysis, but they just had their last dialysis 2 days ago, which is kind of the normal regimen. No recent illness, no complaints, so not considering thrombus, probably not an MI. Can't really figure out too much of what's going on with this patient.
Right. It has been another 2 minutes.
Okay, I'm going to check my monitor, hold CPR. I've got, looks like a sinus rhythm on the monitor. Check pulses. Do I have pulses?
You do have a pulse.
Okay, I do have a pulse. Looks like sinus on the monitor. Stop CPR. I'd like to get 12 lead, blood pressure, SpO2, current and tidal. Is the patient breathing on their own?
Patient's not breathing on their own.
Okay, I'd continue ventilating with BLS airway. Am I getting good compliance?
You're still getting good compliance.
Okay, continue with that BLS airway. What do I have on my 12 lead?
On your 12 lead, you are showing an inferior STEMI.
Okay, so then I'd like to do a V4R 12 lead. What does that show me?
It is showing STEMI.
So elevation in V4R?
Correct.
Okay, well that means that it's right-sided MI, and then I don't want to give nitro for that. What do I have for blood pressure?
For blood pressure, you have 76/40.
Okay. Due to the poor blood pressure, but I've got a good heart rate, I'd like to get orders for push dose epi. Mix that up, and I would give 1 cc every 1 to 3 minutes, IVP.
Okay. As you give that medication, you do notice an increase in blood pressure.
Okay, I'd like to package this patient and transport to the nearest semi-receiving center and transmit my 12 lead.
Okay. All right, you have transmitted your 12 lead. They have received it and said they will be waiting for you upon arrival.
All right.